But the cold weather has certainly taken a toll on a lot of people. More than a dozen are in the hospital right now in Metro Denver this afternoon after getting frostbite or hypothermia in those cold temps this weekend.
How scary. The unit that handles those cases at the University of Colorado, the hospital had their hands absolutely full. In fact, 9 News reporter Evan Krugel joins us now. Evan, doctors were prepared for this, but it's still putting a stress on the hospital system.
Yeah, Sam, the UCHealth Burn and Frostbite Center is the largest center of its kind in the entire Rocky Mountain region. They were expecting this, but they certainly still received an influx of patients. And today, that unit is now overflowing with patients into other areas of the hospital following that bitterly cold weekend. As sunshine returns to Colorado, the snow and ice are finally beginning to melt away. But the impacts of the polar plunge are still being felt at the University of Colorado Hospital.
I'm a bit tired from this past weekend because I would probably got an hour and a half of sleep with like uninterrupted sleep at any given time.
Dr. Cameron Gibson is exhausted from treating patients with frostbite and hypothermia at the UCHealth Burn and Frostbite Center, where 10 patients had to be admitted with frostbite this weekend alone.
So we had our normal census, we had burn patients being admitted, and then we had all these frostbite patients being admitted. So the combination of all that led to doubling of our census.
The influx has pushed the 19-bed unit over capacity. Gibson says more than a dozen patients that would normally be treated on the unit are now being treated elsewhere in the hospital.
We have twice as many patients on our services. We have beds, and so they are spread out across the hospital.
Dr. Gibson says it's a situation he's never experienced, but one he was prepared for when he saw the forecast.
This is the busiest our census has been in the 2.5 years that I've been here. We have not hit this number in the time that I've been here. I'm not surprised, though, that we got the number of patients that we did, given the breadth of the weather system. It's not just one day, it was 3+ days of cold exposure, which really made it a bit unique, the length of time.
Like so many Coloradans, Dr. Gibson is breathing a sigh of relief to see the sunshine, but knows for many of his patients, the road to recovery is just beginning. Now, in addition to treating patients here locally, that unit also helps do consultations for hospitals in nearby states when they have patients presenting with frostbite come into their emergency department. So you can understand how busy they have been this weekend and why they are so thankful to see this sunshine. Sam, Alex, I'll tell you what, we're sitting in the low 40s out here this afternoon. It feels quite tropical compared to what we saw over the weekend.
It's
We're
so
live in
refreshing.
Denver. Evan Krugel, 9 News.
Evan, I'm curious before you go, did they give you a sense of like who these folks were? Were they mainly people experiencing homelessness, or were they outside working? I mean, the concern for folks, you know, our neighbors dealing with these types of conditions.
Yeah, it's a mixture of all walks of life. Unfortunately, a lot of those people are people experiencing homelessness. We spoke with the shelters here in town. They saw record numbers of people during this cold stretch as well. So unfortunately, some people were not able to get inside of that shelter and are now dealing with potentially a rough road to recovery here. Not an easy thing to recover from frostbite, a very painful situation from people I've interviewed in the past, and we certainly hope the best for those 10 people who are still dealing with that at the hospital tonight.
Absolutely. Evan, thank you.